Ladies and gentlemen, please welcome our dear friend from NBC4, Tom Sherwood.
You should have seen her behind the backstage here. She was so nervous. I said, how many speeches have you given? How many talks have you given? And she was so nervous. I told her that Pavarotti used to be so nervous that he said he could not sing. He was afraid he would not be able to sing. He would walk out on the stage until he heard the first note, and then he knew he could sing. So she did a great job. First, I want to say, we're going to have a forum here now. We're going to try to live up to cable television standards. I want to thank Chip Lewis from Whitman-Walker Health, I can't even read, for inviting me to this forum. In about 30 years, someone probably in the audience today is going to be standing up here, and she or he will be telling people what was said and done here. So, any of you might be that person. Pay close damn attention so that you get it. Now let's welcome our panelists. Hold your applause until they're all out here. We're going to start with Cornelius Baker, technical advisor at something called the FHI 360, whatever that is, and senior advisor to the National Black Gay Men's Coalition. Regan Hoffman, editor-in-chief, Paz Magazine. Make the line step it up a little faster. Joanne Keatley, director, they know their names. Director of the Center of Excellence for Transgender Health at the University of California, San Francisco. Robert Redfield, Chief of Infectious Diseases and Director of the HIV Program for the University of Maryland. Adam Tenner, Executive Director of Metro Teen AIDS. Good speaking. Phil Wilson was going to come out, President and CEO of Black AIDS Institute, but he's supposed to be at another event, so he's not going to come out. And Joe Zuniga, President, International Association of Physicians in AIDS Care. This is not going to be a League of Women Voters forum. We're going to have a conversation as soon as I go there and sit down. Talk too long, I'm going to ask someone who knows how to play a piano, play walk-off music. If I do, just let me know. We have just 7 panelists, or 6 now, and just about an hour or so please keep in mind when you answer questions that we don't need speeches. Mitchell Warren of AVAC, the AIDS Vaccine Advocacy Coalition, was quoted recently as saying, "The last several years have delivered some of the most exciting science in 30 years of the epidemic. The idea of the ending of the epidemic is not just a pipe dream. It's actually real. It's possible." Let's begin, Cornelius. Each panelist, just please take about a minute, and I'm timing, to tell us in summary, where are we in 2012? Is hope justified?
Well, Tom, first of all, thanks to Whitman-Walker and the organizers for having us all here. You know, what I would begin by saying is hope is always justified. You know, I was in this auditorium on April 4th in 1983, 84, whatever. Jim brought us all together. And, you know, at that moment we thought that we were all going to die. And a year later, the man that I loved at the time, Bill Fitzmaurice, did die. February 1985. And a year later than that, I got tested at Whitman-Walker Clinic and was HIV positive. And last September, I turned 50. So hope is always a part of our lives. And it is what has fired us up, it's what's fed us, and it's what's helped us to endure. Today, we also have wonderful medicines that can keep people alive, and we have prevention strategies that we know work. So we have a lot to be grateful for, and we have a lot to hope for.
So I echo. I was diagnosed told me I had a year to live. And I lived for about 4 months believing that until I had the courage to tell my mother, who got me to a doctor who told me otherwise, that I might have 2 to 3 years to live. Unfortunately, that wasn't the case, and I celebrated a birthday that I thought I would never be the kind of person that lies about my age. I've always been grateful to have my birthdays, but now I'm officially old enough to lie about my age. So I'm old, and I'm glad. But I would add to the idea of hope, in general, which everyone has, and it's amazing how survival instinct interweaves with hope inextricably. But we also know a lot now. You touched on it. We know how to end AIDS. We know how to prevent AIDS. We know how to keep people alive. What we don't know how to do very well, and we need to do better, is get people tested, connect them to care, and cure the other things. So we're going to work on that. But the hope is a different kind of hope today. It's not blind faith. It's not blind hope. We know. And what I hope today is that we have a second wave of activism, that we can get the political and financial will necessary to do what we know we can do.
Thank you. Joanne?
Well, I too have hope. I have lots of hope that we'll have the political will to continue to move forward with this effort and, truly be inclusive of transgender populations. My problem with the current strategies is that while we're putting a lot of hope and effort on new medical technologies, I don't feel we're doing enough to reach out and engage with transgender populations and keep them in care. I don't think that we've made enough investment in really training providers to be able to care for transgender bodies. I think a lot of even infectious disease specialists, even HIV clinics, are really not prepared to deal holistically with transgender patients. What they, they're infectious disease specialists, but they're not necessarily competent in providing care for transgender patients. And so my fear is that a lot of these investments that we're making into treatment as prevention, that one of the liabilities in that approach, one of the casualties of that approach, is that a lot of programs, kind of the sole, program services that are available for transgender people throughout the United States have been at the prevention level. And when we are transferring or refocusing our efforts into treatment as prevention, I don't know that we've done enough to train those providers to receive those patients that are trans-identified, and then those pure prevention programs for targeting transgender people, I think have a real risk of going away. So my feelings about this are kind of twofold. Hope and anxiety.
Hope with an asterisk. Okay, Adam Cannon.
Well, I echo what she said for youth. Youth are not mentioned in national activities age strategy. Education is not really mentioned. There are a lot of things. For me, the experience of having a conference here in our hometown, I've been reminded of all the things that we should be hopeful for, but also what I feel on a day-to-day basis and what we feel at Metro Teenage is we feel like we're still struggling. I think that, 3 years ago, 10% of all HIV-infected babies in the entire country were born here in Washington, D.C. And now we have no babies being born with HIV. I mean, this is something to be absolutely... And medicine is exciting. And yet, last week, a young perinatally infected young woman who's 25 years old called one of our staff and said, "I'm homeless." She's 24, no shelter will take her, she doesn't have kids. And so the struggle continues. The struggle.
Robert Redford.
I think there's lots of reasons for hope. I'll focus on three. One, I think the growing recognition of this the synergy between prevention and treatment, I think is really very important. I think there's a growing recognition that any comprehensive prevention program really requires the ability that people with HIV infection can get diagnosed, get into care, stay into care, and get effectively treated. I think we have a long way to go. Those of you who know the national statistics know that probably somewhere between 19 and 20 to 30% of people living with HIV infection in our country actually have moral control. But I think there's an opportunity, and I think there's a will, and I think there's the capacity for us to begin to provide effective therapeutics for everybody with HIV infection, and I think there is the political will to do that. On the science front, I would have never said this even 5 years ago, but I think actually the ability no longer to use sustained viral suppression in the human constitution as the therapeutic endpoint, I don't think that's going to be the therapeutic endpoint at the end of this decade. I actually think we're going to begin to see the ability to reduce what we've all said was stable, what we call the reservoir or profile frequency, so that some people will begin to be transformed into what some might call a functional cure, that is to be able to become antiretroviral independent and live like a number of the patients we have that are natural viral suppressors. If I had even thought that was feasible 5 years ago, I didn't. I thought I would see the end of my life without the ability to see a functional cure, but I no longer take that position. And I think you'll see a lot of significant scientific progress. I'm not saying for everybody, but I think we've all begun to see an acute infection with HIV infection. We're starting to see significant changes in profile frequency, which we never thought we'd see before. And the last, I'll just put on the issue of a biological vaccine. I think those of you, again, close to the subject saw that several years ago that for the first time, even though it's only a hint of efficacy, it's the beginning of showing the possible. With a study that was performed in Thailand by the United States military in partnership with them, showing a 32% protection rate. It's beginning, it's a path. So I really do think this decade is going to bring expanded access and treatment and effective therapy for all of us living with HIV infection. I think there's going to be progress towards functional cure, and I think there'll be significant progress for vaccine.
Thank you. Jose?
I think hope shines bright. We have saved millions of lives through the provision of antiretroviral therapy. And of course, there are challenges to optimizing treatment, ensuring patients are engaged and retained in care, virally suppressed. But we should really take heart what progress we've made over the last 30 years and continue to build on it. I think too that obviously with recent developments in the area of treatment prevention and pre-exposure prophylaxis, we do stand a chance in our lifetime to end this pandemic. I believe that in my heart, but it's going to require concerted effort, resources of the nature that perhaps some are afraid of dreaming about, but need to become reality. With this hope, though, it also serves to shine a light on the inequalities, the inequities, all the horrible, the racism, the sexism, the homophobia, the transphobia, that are all barriers to our achieving the goals we have in mind. Having said all that, I remain highly hopeful and optimistic.
So we all have hope with an asterisk. But I want Adam Tinner from Metro Teenage. He was telling me this backstage. I thought you should hear it. He was on Fox TV station, Ledge TV station. For local TV. So give him some slack. 3 hours you had folks from Metro Teenage answering questions. I'd like for him to tell you some of the questions they got from people calling in. Adam.
Well, I think one of the things in Jeannie's speech that she talked about, fleas, mosquitoes, saliva, were the questions that we got today.
Questions that we had 20 years ago, 25 years ago.
30 years.
30. Swimming pools?
Pardon me?
Swimming pool
Well,
questions?
and swimming pools. I had 2 separate calls that if somebody was HIV positive and was in the swimming pool, could they catch HIV from going to the same swimming pool? Unbelievable, the level of the questions that folks had. And to me, it underlines a lot of our work in terms of what we need to do around really fixing education so that young people know how their bodies work, know how to protect themselves, know what to do. And these were not kids calling in, these were adults, mostly adults calling in.
Panel members, any